Hi, everybody. Welcome to our Friday live stream at Medical Device Academy. Today, we're going to give an overview of the FDA eSTAR program and the FDA eSTAR template for 510K submissions. So I'm going to walk you through our workflow as a company, at least the way I personally do it. Everybody's going to do it a little bit differently. There are a lot of tasks to do, and it takes a little bit of time to fill it in. So we'll talk a little bit about that timing and what order I do things in and why, but there's not a right and a wrong way. The end goal is we have a completed FDA eSTAR that we upload to the FDA website, and then the review process begins. So that's what we're covering, is how to get to that point where you have a completed FDA eSTAR so you can submit to the FDA, and what are some of the important steps along the way, particularly the ones that people miss, and how to organize things so it runs a little bit smoother for your company. So as I go through this, I'm going to share my screen. Some of the text, I apologize, is a little bit small, so I'll try to make it as visible as possible. But I'm going to show you actual files that we actually use here and how we organize it, because we always try to use a template to make it faster and for consistency on how we do it every time. It makes it easier to hand off the project to another consultant. It makes it easier for somebody to come in, figure out how you're doing things, and to help you. And it also makes sure that we're always improving because we're all using the same templates and learning from each other. So that's how we do things at Medical Device Academy. We will start by sharing the Dropbox folder. So in general, I use Dropbox. Our company uses Dropbox. Not everybody likes Dropbox. Some people want to do things in SharePoint. Some people want to do things in Google Drive. Some people want to do things in Box. It's just a file sharing system. We don't care which one you use, but this is the one we use. Why do we have to do it this way? Because I have 2,000 clients plus. Over the history of my career, over the last 25 years, I've gotten over 2,000 clients. And to try to decide, well, I'm going to do these in this platform and these in this platform is craziness. So we do everything in Dropbox, and it's really saved our clients and us multiple times whenever we've had things get deleted accidentally or there's been a virus. It's nice to be able to go back to an automatically backed up version that's clean and pull it up from there. And then we can sort through corrupted files and try to recover any data that might have been corrupted or lost. And we have the team for that. So it's been helpful in multiple times, and it's not just us. One of the times where we had the biggest loss of all to a client was actually a software development company. And they lost all of their files due to a virus that they had downloaded onto one of their computers at home and then brought it to work, and it contaminated everything they had. Fortunately, they let us know right away, and we were able to recover all their design files the following day. So Dropbox really saved us. So that's why we use Dropbox. This also allows me to make sure only certain people in our company have control of the documents. So periodically, we remove access to files when they're all done with the project, and it's only limited to me because I'm the one signing the NDAs. And if the client wants to take control of those files, we just change the ownership of the Dropbox folder from me to the person at the company, and then now they control that Dropbox folder and who has access to it. So that's why we use Dropbox. In this simple folder, it's labeled our kickoff folder for 510Ks, and I need to edit that name there so it says 510K instead of 51K. This is the demo version that I'm using for this video, so that's why it's not perfect. But we have usually a file for the clients to review. So any files that we're editing and we want to communicate, hey, please review this. If we're going to do it in Dropbox, we put it there. If there are any files the client has for us to review, so they created a draft of, let's say, a software architecture diagram, and they want our feedback, or a software description, or a device description, or an IFU, they can put that in that folder and we'll review it. When the files have been reviewed, then we're going to move it to the 510K submission folder, and I'll show you that in a minute. We also have a legal folder. That's where we put things like confidentiality agreements. I usually create a potential predicates folder because at the beginning of the project, we don't always necessarily know exactly which predicate we're going to use. There might be multiple options, so I like to put them there. And sometimes we have a backup plan for a predicate when we're not exactly sure, or a reference device. That's the kind of stuff we put in there. The next thing on the list is the small business designation. Very, very rarely we have a client that is large enough or has been acquired, as we've had one client recently was acquired, where they're too big, at least through their affiliate acquiring partner, to get small business status. So if you're more than $100 million in operation revenues per year, or your parent company is, or your subsidiary is, or collectively together, you're more than $100 million in revenue per year, then you're not eligible for small business. But that's usually only one of our clients or two of our clients out of potentially over 100 clients at any one time. So with that many projects going on that need small business status, we routinely see all kinds of little hiccups in the small business designation. We recommend every year on August 1st, because it's the earliest possible date you can apply, to apply for your small business status for the next fiscal year. And it takes a 60-day period for them to give you that small business designation. You have to upload all the forms now to the CCP website. So that's a customer collaboration portal. So now all submissions are electronic for a small business designation. No more FedExing them. That's a change that they made. They still use the same forms, but you have to attach the full tax return and the small business designation and upload it to the FDA if you're a U.S. company. And if you're a foreign company, you're just attaching the international version of it, which is 3602A. And on the back of it, it has you sign, date, and stamp from the National Tax Authority saying that the numbers are accurate for the taxes. And then you upload that to the FDA's CCP portal, and that begins the small business designation request process. And it's supposed to take 60 days. Lately, we've seen some delays in the process, so hopefully that'll get fixed by August 1st when everybody's applying for fiscal year 2026. But right now, we're seeing some problems with it. So beware. You can apply any time of year, even today. But if you're applying for the next fiscal year, 2026, you got to wait until August 1st. That's the earliest possible. But there's not a deadline for submission. It's any time of year you can apply, any day of the year you can apply. But the earliest you can apply for fiscal year 2026 is August 1st of 2025. And it takes effect October 1st, so you won't get your small business designation until then. So that's my little spiel. And why would you do this? Because it's going to save you over $18,000. And that's in fiscal year 2025. It'll be even more in 2026. The next thing I put in this folder is a workflow. And this is brand new. I'm going to make this pretty. Right now it's just text. But I'm going to make a pretty workflow. And we're going to keep on updating this over time and adding more detail until it's a full-blown presentation that has a lot of detail and hyperlinks and everything. But for right now, I just wanted to give you sort of the step-by-step key items that we cover in the 510K workflow. Number one, our company uses Monday.com for project management. So some companies don't like to work in Dropbox. They want to work in SharePoint or something else. Monday.com allows us a place that is neutral, if you will. It also is free to them because they're our guest. It's our Monday project, our license. So our whole company uses Monday, but we can invite any guest to any particular project securely, and they'll only have access to that project. We can give them view only, or we can give them editing capabilities. But by putting them in that Monday.com project for their 510K project, now they can put the documents in Monday.com instead of using the Dropbox folder. So that's one of the things we like to do. It also will send notifications to the person of tasks that need to be done. People can put in questions there. So it's another way for us to communicate with the client and share files instead of Dropbox for people who don't want to use Dropbox. And it also encourages everybody to use better project management skills. So that's one of the things we like to do. Number two on the list, we want everybody to remember, please apply for small business designation. You are going to need to create 2 FDA accounts. One of is a DFUF account. So that's your device facility user fee account. That's where you pay your user fee. So if you already have a user fee account, you don't have to create a new one. Just go in there to look up your organization ID number. You'll need that to apply for small business status. It's the only purpose for applying for the small business designation is to get that org ID number. It comes to you free, but you only get one per company. And you can have multiple DFUF accounts. Every single email under the sun can have a DFUF account for a specific company, but you only get one organization ID per organization, and they're tied to either an EIN number or they're tied to a Duns and Bradstreet number. So if you're outside the US, it's going to be Duns and Bradstreet. And if you're in the US, you need an EIN number. So keep that in mind. You'll need a DFUF account. And if you're a foreign firm, you'll need a DUNS number if you don't already have one. The second kind of account you need to create is a CCP account. The CCP account is also called the Customer Collaboration Portal. That's how you monitor your submissions. That's also how you update your and upload your submissions. It gives you a tracker to show you who's the lead reviewer for your submission, what their email their number is, and what the status is in terms of days to completion for the decision on your 510K. We can create a DFUF account for you with our email. We can create a CCP account with our email. We have both, and we've done it multiple times. Or you can have them. It doesn't matter who submits the payment. The FDA doesn't care. They just want the money. And they don't care who submits it either. So anybody can have a CCP account. Anybody can have a DFUF account. And you can have more than one, and we do have more than one. So that's the second step. The third step is export the data from your FDA pre-STAR if applicable. Now, this implies here that you should be doing pre-subs. So the purpose of a pre-sub, for anybody that haven't seen my pre-sub webinar, the purpose of it is not to help you design your device. That's independent of what a pre-STAR is about. The FDA can't give you a device, or can't give you advice on how to design a device. They've already seen how your competitors design a device. They can't give you hints. So it's not about designing a device. If you're not done designing your device, that's okay. It's not about designing the device. It's about your testing plan for the device when you're done and ready to test it. And there are different things you test at different times. So I say the purpose of a pre-sub is to forge a better testing plan. And I use that word forge intentionally, because it might take multiple times dipping it into the fire called the FDA and hammering it out with the FDA before you get it perfect. And it probably never will be perfect. There's always imperfections in forgings. It's a manual process. So you go as far as you're going to go and then say, okay, this is good enough. Now let's start the testing. So it might be 2 tries. It might be 3 tries. If you're lucky, it might be 1 try. For something that's fairly well established, like biocompatibility, you might know exactly what you need to do. But the idea is you send them a test plan, you send them test protocols, and you ask questions about it. And they give you feedback. You make revisions, send it in again, or start your testing. So if you've done a pre-STAR, like we recommend, and you have your test plan all figured out, in the process of submitting the pre-sub, you filled out an FDA pre-STAR. Hopefully it's version 1.3, the latest version. You can export from that. It will give you an XML file, and then you can import the XML file into your new FDA eSTAR that you're going to fill out for your 510K, because they use different templates. The way you know which one you have, once you filled it in, the pre-STAR will be about 15 pages of a PDF, and you'll have about 30 pages if you're doing an FDA eSTAR for the 510K. The pre-STAR is version 1.3 right now. The latest version of the eSTAR is 5.5 right now. And you can go visit our page on FDA eSTAR if you want to know more about the versions. Once you've imported it, now you have all your company information. You might have your consultant's information if you're using the same consultant like us. You might have device description information. You might have classification. You might have the review panel. You might have the predicate. You might have information about standards that are applicable. You might have your indication for use. All that information that you put in there, it will try to upload the information from the XML file into the FDA eSTAR template. Sometimes it doesn't all come over properly. Sometimes you didn't fill it in the pre-STAR. It was an optional item, and now you have to fill it in the final version, but it'll save you a lot of work if you use the pre-STAR in advance. So just another reason to use the FDA pre-STAR template. It also teaches you the user interface and how things are organized. So definitely recommend using the pre-STAR template for the pre-submissions. The next thing you're going to do, you're going to update your device description and your user manual. The reason why you're going to update them, they were drafts when you submitted them to the FDA. In fact, the user manual isn't required for a pre-sub, the device description is. So your device description might be pretty close to final, but your user manual, I guarantee, will need edits. Even if you did everything by the book, the FDA always has some suggestions for improvement. They always want you to make updates. There's always new symbols. There's always new regulations for warnings and precautions. So you're probably going to have to update that user manual. But I would be willing to bet you have updates for both documents. So if you created a draft of both of them for your pre-submission, now you're going to have to update them. If you don't know how to write a device description or don't have a template for that, check out our video on device descriptions to learn how to do that. That was a recent live stream video that I did. And you can actually type in the information on our website and download our template if you want to fill it in. The user manual, we also have a whole entire webinar on how to write instruction for use. And we actually have templates for that. So it includes the symbols, it includes the different sections you should have. So I highly recommend using a template for that. And once you've done one submission, create a template from that so you're always including the same kinds of things for your product families. Now that you've updated your device description and your user manual, the next thing I like to do is to populate the 510K templates. These are Word documents. There are only a handful of them, so I'm going to show those to you. And over time, we've actually had less and less of them, not more. So the ones that we have right now, we have one here for 510K statement. And I'll make this even bigger. I'll crop myself out. There we go, to help you out for seeing. Number one, we have this 510K statement. If you do a 510K statement, you fill that in. If you do a 510K summary, you can use the automated version that the FDA has, or you can use our template. I recommend using the 510K summary that is automatically generated by the eSTAR. But in order to do that, you need to know what information should be put in the text boxes, or it will not properly populate the summary. So if you're not sure how to write a 510K summary, you might want to get some help on filling in those text boxes. For example, they're going to ask you, justify your differences in indication for use. You've got to explain that in a text box. You've got to explain your justifications for differences in technological characteristics. You have to have a comparison table. So that's another template that I'm going to get to in a minute. And then you get to the section on testing. They want to describe the non-clinical testing that you did in a text box. Now, there isn't a box, unfortunately, saying, please explain what biocompatibility testing you did. So I put that information in the non-clinical testing text box as well, because I know the FDA wants it in the 510K summary. So I start with what is the biocompatibility testing we did, and it could just be a bulleted list. Then the next thing I will put in is the testing that was done for non-clinical benchtop, standards, and a bulleted list once again. And then the last section that you're going to have to worry about is your conclusion. So if you don't know how to write a conclusion, it's going to be very short, but it's basically going to say that the results of the testing show or demonstrate that your subject device is equivalent for safety and effectiveness when compared to your predicate device. And so that's essentially what is going to be in that summary text box. So you've got your boilerplate information that will automatically get pulled from other sections of the document in the eSTAR into your 510K summary. You have your substantial equivalence comparison table that I'm going to get to in a minute. You have your justification for differences in the indications. You have your justifications for differences in the technological characteristics. I forgot. You also have a device description section. So that's the general description paragraph at the very beginning of our device description template. That's what gets copy and pasted into the eSTAR. That's one of the sections we fill in. And then you have the description of the non-clinical benchtop testing. And as I said, I typically start with biocompatibility and then the non-clinical. There are other sections for animal and clinical that might be applicable to your device. But after you've filled in all the text boxes, then that's going to automatically populate in the 510K summary. You could attach a Word document instead or a PDF instead, but I recommend using the automatically generated one. Try that first and be prepared. You might be asked to create a new one or to provide one that the FDA can edit, because it's easier for them to edit a Word document than it is for them to edit the eSTAR. So you may have to do that, and that's extra work for you. But if you're using templates, a copy and paste from your eSTAR into there to start out. The next item we typically fill in, and I'll go back to our list here in our flowchart. The next thing you're going to do after you've populated all the templates, I didn't cover all the templates. So let me cover the rest of those. The next one's the 510K cover letter. So we recommend you have a cover letter. We have one here. Everybody has different cover letters they've developed over time. We don't have the perfect cover letter. There is no such thing as a perfect cover letter. There's cover letters that don't have enough information, and the FDA asks you to modify the cover letter and resubmit. So that would be a technical hold item. So you can use our cover letter. You can create your own. You can use somebody else's. The only bad ones are the ones that don't have enough information. So don't skimp on information. And the cover letter doesn't get published anywhere. It's just internal for you and the reviewer. So the reviewer knows all the details about your product at a high level so they can populate their database internally. So somebody actually has to take that information and move it into their database to create the workflow so people will start reviewing your 510K. So this is the first thing they look at, is that cover letter. So make sure it's accurate and make sure everything matches what's in your eSTAR. So that's the reason why we fill that in early, because we're going to copy the information directly from the cover letter into the eSTAR. I'll repeat that. I fill in the cover letter first, and then I copy and paste the information into the eSTAR, not the other way around. Okay? So that way we know everything's consistent. And it's a lot easier for me to copy and paste it from Word document into the eSTAR instead of the other way around. It's just because the eSTAR template, because it works on Adobe, is really, really slow. These next three documents here you're only going to use for clinical studies as financial disclosure documents. Those you probably don't fill out at all. You probably send those to your customer or client to fill out. Whoever did the clinical study is going to fill those out. If you didn't do a clinical study, just delete those templates. Then you have the two eSTARs. We update these periodically as the FDA provides new ones. If you have a non-IVD device, you fill out that one. If you have an IVD device, you fill out this one. If you're not sure, when you fill in the classification, if you filled in a classification for something that should be one of the other templates, the eSTAR template will tell you made a mistake. So, and it also even gives you an email to check if you're not sure. So we take the one we don't need and we move that to archive. Whenever we have something that's obsolete or an old version, we always move it to archive. We don't delete things, because as soon as I delete it, somebody will want what was in the old version. The next thing we fill in is a response memo for issues raised in the pre-sub meeting. A lot of people don't realize this is required. So when you do a pre-sub, you have concerns raised by the FDA. Some of them you address, some of you didn't address. So the best thing to do is, as soon as you finish your pre-sub meeting minutes, populate this response memo while everything's fresh in your mind with any open issues that weren't resolved in the pre-sub. You might go line by line through the different questions you asked in the FDA responses and say whether it was resolved in the meeting, or if it was not resolved, how you plan on resolving it in your 510K. But fill that in early before you forget. Ideally, right after your pre-sub meeting minutes are filled in. The next thing is your substantial equivalence comparison table. I would at least start this at the very beginning of the project by putting in all the information in the table that's available for the predicate device. If you don't have a table that was provided for your predicate, and I was just filling out one last night for a catheter that didn't have a table, I had to create a table. So the eSTAR requires that you attach a table, so you better come up with a table. And they even give you in the guidance for substantial equivalence what they want you to look at. So typically you start out with, what is the name of the device? What is the K number? What is the classification? What is the regulation number? And then we get into the good stuff. The indication for use has to be in there. And then we get into materials, so material differences. Power, so what's the power source if it's a powered device? You would say NA if it's not powered. And then you get into the design feature. So you might say, is it terminally sterilized? What is the method of sterilization? What is the sterility assurance level? So those are some of the things that you might cover as comparisons. For the catheter I was working on, it was the length of the catheter, the size of the introducer. I'm not giving away any secrets. I was copying all the things from the predicate. So because they didn't have a table, I went to the predicate's IFU, instruction for use. And I said, well, what things did they tell me in the IFU about this device? They told me the diameter. They told me the introducer sheet. They told me the guide wire size. They told me the working length of it. They told me what kind of flow rate, all kinds of stuff they gave me about this device in their instruction for use. That's public information. So I copy and paste that from their instruction for use into my table, and then I try to look for the same things in our draft instruction for use, and I populate it. Now, some of the things in our instruction for use might change because we might not be quite finished with the IFU. We might not be quite finished with the design. So things might change, but at least I want to get everything down there for the predicate device right from the start. The next thing I have is the IFU template and label template. Like I said, if you've already done those for the pre-sub, that's great. Just update them. If you have not done them, we have templates here for how to do those, and they cover the symbols as well. You might have to look up in the symbol standard for additional symbols if we don't have all of the ones you need. And they're always creating new ones. And then the last thing, if you are a consultant filling these out like we are, the person filling out the template is not the person that's signing the truthful and accuracy statement. So then you need to create a Word document with their title and their name, and they have to sign it. And then you attach that PDF. If the person that's filling in the eSTAR is the person also signing, then it's easy. You just say yes, and it'll automatically generate one for you. It'll automatically put your name in there as the person that filled out the eSTAR, and you'll just have to sign it. So that becomes a secure eSTAR signature on there. So you could do it that way, but normally we just do a statement and have the person sign it in advance. So we have that all done. Technically, you're supposed to do this at the very end of the process, just before you submit. I usually try to get it done at least a week before when they make the payment, but I fill out the template really early because their name and title is probably not going to change. So those are all the templates that we fill in. After that, it's mostly filling in the eSTAR itself and filling in the test reports. So we will go back to our workflow. So I said, populate all your 510K templates. Those are the Word documents I showed you or was walking you through in our Dropbox folder. And now next I go answer all the questions in the FDA eSTAR. So I happen to have the eSTAR already open. Here it is. This is the non-IVD version. It's version 5.5. And when you first open it, it'll only be 3 pages long. Right now, it's 24 pages long. So the reason why this is 3 pages long, or is not 3 pages and it's 24, is because I answered this question, pre-market notification. As soon as it knows the submission type, it populates a whole bunch of sections below. As soon as I say it's a traditional type, it populates different fields than abbreviated or specials that require summaries. 99% of your submissions are going to be traditional. Maybe it's more like 95%. But a small percentage are going to be special 510Ks. These are minor device modifications to somebody that is using their own device as the predicate. And abbreviated submissions are almost gone completely now that people are using the eSTAR. It really isn't saving anybody time to do an abbreviated submission. It's supposed to make it easier for the FDA to review, but they're not promising any faster delivery of your decision with an abbreviated. It's supposed to give them less to read. And 9 times out of 10, they ask me for the final report because the abbreviated doesn't have everything they want to know. So I don't recommend abbreviated. I recommend traditionals. But there are a few guidance documents out there. They say the FDA would prefer an abbreviated submission. And all of those guidance documents predate the existence of the eSTAR. So that gives you a hint. The eSTAR replaced them. And then new application or submission is what you're always checking. Unless you've already submitted, you've gotten an AI hold letter, then you're checking this box instead. But the first time you're populating the eSTAR, you're checking this. So I've already checked those 3 boxes. Now I go down below. This is where you're putting your cover letter. That's a required element. This red bar indicates it's required. You're filling in your information, your company's information. And if you're a consultant, helping them out. You're checking this. Now we have a whole section for the consultant to fill in. If there were previous submissions, like a pre-STAR, you would check yes here. And now you're going to have to say what the number is and attach attachments. So meeting minutes, response memos, that's where you would put that. Your actual email response from the FDA, all that stuff gets attached here. And you might have multiple resubs. So if you do, then you're going to have more attachments here accordingly. And then you also add standards and always use the drop downs for the standards. And you can add more standards. So you just click on add standard and it adds another standard. If you added one too many cells, just delete a standard. And it takes a little while once you hit buttons because it's Adobe. It's very slow. The next section is the device description. We fill in all this. Based on your answers in this device description, between the line that says general device characteristics and the description line, these answers here determine which sections of the 510K template, the eSTAR template, will be populated. So if you answer a question wrong in this section, it will result in a technical hold and you'll be missing information from your submission or populated information you didn't need. So if there were going to be something I want to have somebody double check really early on, I would fill this in early on when I'm writing my device description and answer these questions correctly. And if you did the pre-STAR correctly and somebody was looking at it, it should already be filled in correctly. So another reason to do a pre-STAR, so you make sure this section is populated correctly and you just export from your pre-sub into your eSTAR and you're good. Here's where I put in my general description. So I pull that right from our device description document and I copy and paste it into that template. It's usually just a paragraph or a couple of paragraphs, not the whole document, not all the pictures and attachments. You're going to attach that full document here. The pictures they want here and any drawings they want here. And then they have a separate one for packaging. The packaging is optional. But ideally, because this is your final submission for clearance with the FDA, you'd have a complete device description, all your pictures, all your drawings, and you'd have your packaging. And a lot of devices are sold as kits with accessories. So you got to decide yes or no on that. If it's yes, now you're going to have additional things that you can attach because it's a kit. So you would attach a list of the 510K cleared accessories that you're using. If it's not 510K cleared or PMA approved or exempt, then you're going to have to include that information in the submission as well. So if you invented your own new guide wire for your catheter, you're going to have to get the guide wire testing done as well. And that's another component in the kit. So the guide wire, some of the guide wires are exempt, some of them are not. So if you have an exempt guide wire, it's not already on the market. It's a custom-made one that's specific to your device. You would add that information in your submission. So little details as we go throughout the whole thing. There's details, details, details. Here's the indication for use section. This used to be called FDA Form 3881. That's completely gone away now. Now they don't have that form reference anymore, but it looks the same. Here you put your K number up here if you already have it, but you probably don't because it's an initial submission. This automatically gets populated from the device description section, so you shouldn't have anything to type in there. It should already be pre-filled in for you. And the indication for use gets typed in there, and you can copy and paste it from your user manual or IFU. That's the best way to do it. Just like I said for the device description up above, copy and paste it from your device description document, copy and paste your indication for use from your user manual so they match word for word. And then check one or both of these. Here's the classification section. When you fill this in, always use the drop down, and based on the drop downs you pick, it will tell you whether there is it will actually refer you to the page that has the classification for the document. And then on the classification page is where they tell you whether there is a guidance for that type of device. They used to actually have it in the eSTAR. Now they have it on the FDA webpage because it's easier for them to manage that there than it is to keep on updating the FDA eSTAR. The next thing we have here is the predicates and substantial equivalence. This is where you're going to attach, you're going to put all the information about your predicate and then attach down below here your substantial equivalence table right here. The first text box I mentioned before is justification for differences in indications. The next one's justification for differences in your technological characteristics. And then we get to the labeling section. They ask what page can it be found on your labeling. So that's why you need to fill out your labeling early. And then we get into the technological characteristics section with testing. This section would not be populated if you didn't have a sterile device or have a shelf life or have a reusable device. So any one of those three would trigger this section. So based on how you answered questions in the device description section, that determines whether this section gets filled in and what parts of it get filled in. The next section is biocompatibility. If you said it's non-contacting or there's no indirect contact, then this would not be filled in. It would be showing as already green. It would be not applicable. But if we check yes, then this section has to be filled in. And it will fill in with a lot more details once you start saying, how many tissue contacting elements are there? We'll say there's one. Look at all the questions it now asks me. It even talks about things like your attachment G and your previous 510K that might have the same materials. So you can include a biocompatibility certification statement instead of testing. And then you attach your test reports down here. Then we have the software, cybersecurity, and interoperability section. So if your device has software, cybersecurity, and interoperability, these sections will automatically populate based on how you answered the device description questions. It's a very long section. This has doubled in length recently when they added the cybersecurity requirements. Then we have the EMC testing. So if your device is powered, this section will be applicable. If you have wireless functions, there's more things that get populated. So as soon as we say yes to wireless, a whole bunch more stuff to answer. That's how this form works. And then we have near the end, we're not at the end yet, but this is the last testing section where they ask performance testing. And there's three types of performance testing. One is non-clinical benchtop. One is animal testing. We also sometimes disguise animal testing as calling it preclinical testing. But what we're really saying is animal testing in a nice, kind way. Sometimes for things like hemostatic agents, where we stop bleeding of major blood vessels, we want to know that it works and it will actually stop the bleeding. And how are you going to show that blood clots? With something that's bleeding, unfortunately. And it's hard to get cadavers to bleed because they're filled up with formaldehyde. So we use animals that are alive, unfortunately, for those types of tests. We had a client that was doing a study for a heart device, a heart catheter. They had to do animal studies for that. And all the companies that were doing those heart catheter studies were having to do the animal studies too. So the FDA is consistent. Either they require it or they don't. And they try to minimize, but some things you can't demonstrate on a cadaver. Some things you can't demonstrate on a sawbones model, and you have to do, let's say, for a bone void filler product, I have to show that it actually integrates osteoconduction or osteoinduction, integrates the bone void filler with the bone. And that requires time. So you have to actually damage the animal's bone, put the bone void filler in there, sew up the animal, and let them live with that and heal. And then you euthanize the animal and study whether that bone void filler integrated with the bone. Whenever we can, we try to eliminate these studies however we can. But some things can only be tested one way, unfortunately. And then the last type of performance testing is the clinical testing. For clinical testing, these companies always want to avoid these because they're very expensive, but some things can only be demonstrated in a clinical model. All your well, not all, but most of your de novo submissions are going to have clinical testing. Most of your PMAs are going to have clinical testing. AEDs, automatic electronic defibrillators, would be an example of a device that doesn't necessarily require a clinical study because they can send in simulation data to see if it can properly identify. I always forget to look on my other screen over here. I try to focus on this one and focus on the camera, but I want to just do a little shout out here. Anytime somebody joins, thank you for joining very much. And if you have any questions, please put them down below. After you've answered which testing is applicable, let's say I just clicked on this one, yes, for this benchtop, and I said no for the others. Now I've answered those questions, and it populated more questions down below for me to fill in about the benchtop and to attach the results. It asked me to include a summary. So right below this yellow box, it's asking me to put a summary in here describing how the tests that we did support substantial equivalence. So that information is part of the information that automatically populates into the 510K summary. And so down below here, we have a reference section. So if you attached any journal articles, you'd say yes. And then it asks you to attach them and explain why you attach them, each one ideally. And then we would say, it's a consultant filling this out. So yes, we're going, I'm sorry, that should be no if I'm a consultant. And you would attach the truthful and accuracy statement right here. And we're going to say we don't want to attach a 510K summary. We're going to do the automatically generated one. So we'll say no here. And it'll ask me to attach the instead of attaching the 510K summary, because we said no, it will automatically generate one below. We attach our user fee payment here. And we type in the number from the top of the user fee form, and it pre-populates a 510K summary for us. And here's where it tracks all the things that we've completed are on the left-hand side, and all the things we have not completed are on the right. And if they update to version 5.6 or 6.0 for the template, we're going to have to export into an XML file and then import into the new version. We don't use this admin functions thing. That's only for the FDA. And this tells you more about delivery of it to the FDA, but we typically are uploading it directly to the CCP portal. So that covers all the things you're filling in the eSTAR. Now we're going to go back to our workflow. So we answer all the questions in the FDA eSTAR that we can, and now we're going to start saving documents. So we have the first one is save drafts to originals. The next one is save final documents to attachments. And the last one is move obsolete versions to archive. So I'm going to show you those. So here's our Dropbox folder. We have an archive folder, we have an attachments folder, and originals folder. A lot of people have a separate subfolder for each type of testing. So they'll have a separate folder for biocompatibility, a separate folder for EMC testing, a separate folder for, let's say, usability. So they organize them by subfolders. And that keeps everything nice and neat and organized. But it's not necessary. Okay? If you want to do that for your originals documents that you're in the middle of drafting, that makes perfect sense to me there, but not for the final version that you're attaching. The final version that I'm attaching, the only reason why I have a separate attachments folder is to keep track of which documents I've actually attached. I don't actually put anything in the attachment folder until it is final file and I've actually attached it to the FDA eSTAR. I don't do that because when I export documents from the eSTAR and import it into a new version, so let's say I'm a week away from submitting and the FDA updates the template to 5.6 or 6.0. If it's 5.6, I have the option of updating. I don't have to. If it's 6.0, I have to update it. So now all the things that I typed in the form will transfer over with the export function, but the attachments will not. So now I'm going to have to keep track of all the ones I attached before and reattach those. So I'd like to put them in the attachments folder when I have attached them. And then if I have to do an export and import into a new version, I can just go down the list and attach all those documents. And when I open up that folder, so right now that folder is going to say nothing. See, it says 0 items at the bottom of the page, if you can see the bottom of the page down here. But if it said 19 attachments, I would know there are 19 documents, and I would make sure I attached all 19 in the right places, and I would probably keep count of them. I'd do little hashtags on a piece of paper or something like 1, 2, 3, 4. Okay, I got them all. or I could put them into an Excel spreadsheet or whatever I want. But I keep track of my attachments only at the time of attaching. While I'm working with drafts, I put them in my originals folder. If you want to organize your originals folder in all kinds of subfolders, go right ahead. But I don't advise you to do that for the attachments because it just slows you down. Honestly, a small submission only might have 10 attachments. A big submission with software and cybersecurity and maybe some EMC testing, you might have 50 or 100 attachments. That's how these submissions get up to be thousands of pages long. It's an electromedical device with software and cybersecurity and EMC and electrical safety testing. So when you have all those test reports of long documents, they take a long time. You're going to have a list here, but even that's manageable. I can manage up to 100 attachments without putting them in subfolders. And most of you are not going to have that many. Most of you are going to have more like 20 attachments. So when you have 20 attachments, no biggie to just go down the list. If you have 100, I could see using some subfolders, but minimize the number of subfolders. Like do it by section. Here's biocompatibility. Here's software and cybersecurity and interoperability. Put them all in one subfolder. And then the last one, the EMC and the performance. Don't go crazy. And minimize the subfolders wherever you can for that attachment because you're not going to use them. You can't submit folders. You can't attach folders. You can attach documents. So that's how we do this. And as we're going through the process, we're updating the documents in these folders. So we move the obsolete older versions to archive, and we typically have revision dates at the end. So this one has a revision date at the end. These have the version dates, but I normally put my initials RVP and then a date code. So that's how we keep track of what version that is. You could rely on the date over here, but date modified is not always helpful. If you just open it up, save it again, now it shows it's newer when it might not actually be. So I always like to put the date code in the file name itself. So that's how we do things when we're covering one of these 510K projects. So my workflow begins with, just as sort of a recap for everybody, and I will put back on my view so you can see me. Come on. Not what I meant to do. I'm on the wrong page. That's what the problem was. So the workflow, we start with Monday, create a project at monday.com so we can communicate with the client. Here are the tasks that need to be done, and whether they're done or they're stuck, they can ask questions, they can attach files. We can even do version control on monday.com. We can even create Gantt charts from that. So it's very helpful. Number 2, we emphasize small business designation. Start that early. We can do an entire 510K project in less than 60 days. It's going to take you 60 days to get small business status. So why did we tell you 400 times during the project? Because we could have already finished if you had the small business status. We could have compressed the project to less than 60 days if you had small business status and your testing done. So one of those two is holding us up. We're waiting for a small business. We're waiting for a test report. Next item, export data from FDA pre-STAR. So if you did a pre-submission, like we recommend, we can export that data into the eSTAR. Saves us a lot of typing. So I always recommend using the pre-STAR template to save on typing and making sure you get familiar with that template. Keep in mind, pre-STARs, usually about 15 pages. eSTARs, when they're done, about 30 pages. Import data from the XML into the eSTAR. Now we have it pre-populated. We update our device description. We update our user manual. We save those new updated versions in the originals folders. They might get additional edits, but we have them in there. And information we need from them will be populated in the eSTAR, like the general device description, the indication for use, the name of the device, the list of devices, the accessories. Those are the things that we have to include in different places in the submission. So use our templates. You make sure you have the information you need from those two documents, the user manual and the device description template. They'll make sure you have information you need in the eSTAR. That's why those are the two most important templates. Next, we populate the 510K templates. So those are the Word documents that we were talking about. The cover letter is where we start. that we populate the cover letter, and we make sure all that information matches what we have in the eSTAR, or if there are things that are blank, we can copy and paste it directly over. Next thing we're doing is the response memo. If you didn't already do that when you did your meeting minutes from the pre-sub, we would have the substantial equivalence table would be another item. We would have your truthful and accuracy statements. I think there's one or two more templates, but you fill in all those 510K Word templates, then you answer your questions in the FDA eSTAR, and you start saving the drafts of all your documents into the originals folder. And then as they're final and you go to attach them into the eSTAR at the very end, that's when you're going to move things to attachments folder, only at the very end. So step 10 is very end. Step 11, the archive folder, that's going to be ongoing. Every time you obsolete a version or you improve something, put the old version away as maintenance. But at the very end, I'm going to have a very clean folder that's going to have originals. It's going to have the attachments. It's going to have my archive that I don't really need to pay attention to at all. And it's going to have my actual submission as an eSTAR. And all the previous versions of the eSTAR, those are in the archive. So I have that one eSTAR file. Now, when I submit it to the FDA, they're going to come back with acknowledgement letters. So yes, we received it. Here's your K number. I save that in there with the eSTAR. Then they're going to send me maybe a technical hold, or they're going to send me a letter that says it's been accepted and a reviewer has been assigned. So one of those two letters goes in there. Next, I'm going to have an AI hold letter at 60 days. And that happens 99% of the time. I've only had one that didn't. One, me personally. A couple other people in our company have had them, but they're very rare to have it go right to interactive review. And once you have that AI hold letter, now you have to respond to that. So that'll be supplement 1. So we'll have the eSTAR. That'll be the original submission. Then we'll have supplement 1. Sometimes if you had a technical hold, now you have a supplement 2 for the AI hold. And then you have interactive. So I might create a folder for interactive questions 1, interactive questions 2 on each day, and our responses to keep things nice and neat and organized. The more organized you keep that Dropbox folder, the easier it is. And that's why we use Dropbox to keep all those documents organized. Okay, so that covers our workflow for 510K. Sort of gives you an overview of the entire process. Believe it or not, this whole entire thing can be done in just a few days. We have a new consultant on our team, Shaylee. She's done several of them already for clients. So she's proven you can do this, a submission every single week without a problem, if it's all been set up for you and the client's done the testing and has their small business status. And it's a little frustrating on us. They ask, when can you get this done? Like, trust me, the holdups are going to be, we're waiting for a small business status. We're waiting for you to pay your user fee. We're waiting for a test report. One of those three is what we're waiting for. So I hope that helps explain the overall process on how you do a 510K using the new eSTAR. A lot fewer templates. Everything's sort of driven by the eSTAR, but that's how we organize the project. And I hope that helps you for you setting up your own FDA 510K project. Thank you very much, and have a great holiday weekend. Enjoy Memorial Day, and let me know what questions you have in the comments below.